Hi, I'm Annie Sleece, and I'm on the staff at NAMI Delaware. Thank you for tuning in today to this Facebook Live. We're very excited to have Vanessa Rodriguez from Delaware Family Voices join us. But before we invite her in, we'd like to tell you a little bit about NAMI Delaware. First of all, I should mention what NAMI stands for. NAMI stands for National Alliance on Mental Illness, and it is a national organization that's been around for more than 40 years. There is a NAMI in every state, and you can find your local NAMI if you're not in Delaware by visiting NAMI.org, NAMI.org. So, as for NAMI Delaware, first of all, I should mention that we operate independently, and our focus is to serve those who are affected by mental illness in the state of Delaware. And that includes people who identify as living with a mental illness, but also people who care about them, their family members, their loved ones, and the general community. Because in various walks of life, there is impact of mental illness in the community. So the more we know, the better we can do. We do trainings, we do education programs, we offer support groups, we offer advocacy, we have a helpline, and we also have a housing program. So there's lots that you can connect with as far as NAMI Delaware goes. And I couldn't possibly share all of it with you right now. But I do want to share with you a couple of things that are coming up that might be of interest. So, first of all, we have a family support group meeting that is facilitated by two trained volunteer facilitators who identify as having a loved one who has a mental illness. And that family support group meeting is offered for now virtually. And there are 3 dates for that in the month of August. There is one on August 10th, there's one on August 13th, and another one on August 24th. There are peer opportunities for support as well offered by NAMI Delaware. Facilitated in very much the same way, we have two trained facilitators who identify as living with a mental illness, providing support to other individuals who identify as living with a mental illness. That group is called NAMI Connection, and it will be offered in August on August 6th and also August 20th. So all those support group signups can be found on our website, namidelaware.org, on our virtual programs page. There are a couple other things that are also coming up in August. We have a program called Family and Friends, which is a presentation that provides information about what it's like to live with a mental illness and how we can support loved ones who have a mental illness. And it's more education based. It's going to be on August 18th. And also on August 18th, later in the evening, we will host our very first NAMI Delaware book club. So here's the little commercial for the first book that we're reading, which is called Don't Call Me Crazy, 33 Voices Start the Conversation About Mental Health. And that, again, is can be found on our virtual programs page of our website. We'd love to have you join us. And last but not least, we have a Facebook Live scheduled for August 13th to discuss mental health resources for higher education professionals. And that will be with Sarah Stowens of Wilmington University. So with so much going on, you can imagine that it's hard to remember everything to share with you, but I think you're best if you can just check out our website. Now, before we start our conversation, as I always do, I want to remind you that you are not in this alone. We're experiencing some really difficult times, and what we may talk about today may bring up strong feelings in you that perhaps you weren't even ready for. So we want to make sure that you know how to get crisis support should you need it. There is a crisis text line that you can access at 741-741. And also the National Suicide Prevention Hotline is available in Spanish, and the number is found right here on our page. We want to make sure that you know about these resources. And of course, in Delaware, I should mention that we have something called Delaware Hope Line that you can certainly access as well. So we welcome you to reach out to NAMI Delaware for support and education and advocacy. But when it comes for crisis, we want to make sure that you have those resources, because NAMI Delaware does not offer crisis response in its many services. All right. So If you're tuning in live, we welcome you to pop into the chat and ask questions or in the comment section. We'd love to hear from you. And without further ado, I want to welcome our guest, Vanessa Rodriguez.
Hi.
Hi, thanks for being on.
Thank you for inviting me.
Of course, of course. So we know you through a couple of ways. So you're professionally, let's see, you're the
Program
program
coordinator.
coordinator. Yeah, I had it in my notes. I just couldn't find it. Program coordinator of Delaware Family Voices. So tell us about that first.
So I'm the program coordinator of Delaware Family Voices. Delaware Family Voices is a nonprofit organization. We work with families of children with special healthcare needs, and we help them connect with support. We provide them trainings. We help them connect with other organizations in order to achieve a better health outcome, and we guide them through the process of obtaining services through the state when they are recently diagnosed or they are in transitioning from 17 to 18. We try to guide them to obtain everything that is out there for their children.
That's so important. That's great. That's great. So we certainly work with you that way, and we can talk more about that connection later. But we also know you as a volunteer, Vanessa, and we're
Yeah.
so glad to have you. Why don't you share a little bit about what you've done with NAMI Delaware as a volunteer?
Well, as a volunteer at NAMI, I go to outreach events and promote the services and write the programs the NAMI and the support that NAMI offers. I am also the Spanish teacher for the NAMI Basics, and we have done a couple of them through the state.
Yes, and so NAMI Basics is so important, and it really connects
Yes,
with
it is.
what you do at Delaware Family Voices, because NAMI Basics, for those of you tuning in, is a class for parents and caregivers of children who are experiencing mental health challenges.
Exactly.
And because Vanessa can offer this course in Spanish, we can serve more families and we can address the needs of families who speak Spanish primarily, right? And that is so critical. And that really kind of ties together to why we have you on this Facebook Live today. So, as you know, in July was Minority Mental Health Awareness Month. And so we were trying to highlight services that NAMI Delaware is trying to provide and looking to bring more into diverse communities. And we knew that you would be the one to talk to when it comes
Yes.
to Hispanic and Latinx community, because you offer those connections already. And I think your personal experience too can help us have this conversation. So um, I'm going to go ahead and jump ahead, because your professional career as serving families with special needs might also include mental health care needs, right?
That's correct. That's
Yeah.
correct.
And then your personal uh, experience involves mental health as a caregiver. Is that right?
That's correct.
Right.
We are caregivers. I personally experience anxiety, and during this
Yeah.
past months, you
Yeah.
have been tested. And as a
Mhm.
caregiver, having a child, my stepson, he has multiple diagnoses, and the anxiety that comes with the pandemic and
Yeah.
everything that is going on around, you have to be. You have to look for the support that is available to make sure that not only you but your family is safe. And even us that work with families need to recognize when to look for support, where to go, and things like that, and stay connected, because it's the only way that you can be a caregiver
Right.
and do
Right.
your job as a caregiver. So
Right. Right. We have to take care of ourselves first, right?
exactly, that's
Yeah.
correct.
So when it comes to mental health services in Hispanic and Latinx community, where do you see the priority? What should we be doing as a community, and then also as NAMI Delaware? What do you think the biggest challenges are?
I think stigma is something that they need to overcome. That is something that we need to um, teach and keep repeating, this is, you're not alone, you are not the only one. And the stigma, along with the language barrier, is
Mhm.
something that we need to work with. Because let me hold on. I'm so sorry. I'm just muting my emails. Um, they
Always
are not,
working.
that they are not alone. That this is not only happening to you, to anybody in your family. That you can go and look for support, because there is going to be support in your own language. So if you're afraid that you're going to be labeled, that you're going to be forever known as something, that no, this is not different from a different diagnosis. And we need to start spreading the word to Hispanics, because that's hard. And the lack of services in Spanish, the lack of education, orientation, support in our language, is something that we need to work together and help those out there that need the support from us.
Absolutely. I think that totally connects with what you and I were talking about right before we went live. The services that I shared at the top of this video are all offered in English. And you and I chatted about that, and we were trying to figure out a way to share those in a way
Exactly.
that's going to address this challenge. And what we decided really was that people like you help us at NAMI Delaware offer the services in Spanish. So that
Exactly.
NAMI Basics will be coming out in Spanish again virtually this time is because of you, and people like you are out there who can help us. Um, so that kind of goes out of order from what we'd planned to share, but I'm going to ask Wesley now to announce what we have. Wesley's on the back end here on a technology side, to share an image of two new staff members that we are bringing on at NAMI Delaware to help serve this need. And we are thrilled to have, Jacqueline Contreras and Esteban Garcia, who will be focused in Sussex County, serving. Their role technically is multicultural engagement coordinators, but they are both bilingual, and they will be helping serve this need. Thank you, Wesley. Welcome, Esteban and Jackie. So that being said, you are going to help us bring NAMI Basics in Spanish virtually, which we've done in person before, but now we have to learn the whole virtual thing.
Exactly.
So those of you who are tuning in, if you're interested in NAMI Basics in Spanish, please give us
Yes.
a shout. And on top of that, we are working toward bringing a support group in Spanish as well. And that hasn't quite taken that shape yet. So I don't want to announce too much, but I do want you to know that we're looking down the road for that very soon. And
Okay.
any other services that we offer in English that you would like to help us bring in Spanish. And I'm saying this to our audience tuning in right now. Reach out. Let us help
Exactly.
bring that. We have that Compartiendo Esperanza course, which is fantastic. It's sharing hope. It's a 90-minute, basically a presentation. It's like a program/presentation. Have you been part of that, Vanessa? I feel like,
Yes, I
yeah,
was.
yeah.
I
So it's
went to
like
one.
you have a booklet and you read through mental illness information and statistics, but it's addressing the needs in the Hispanic Latino community,
Yeah,
so that that stigma you were talking about is addressed directly, right?
exactly.
And Compartiendo Esperanza is a course that we could get other volunteers to be sharing. And that's something we'd love to hear people might want to help us bring. Again, like, we can only offer what we offer when we have the people who can do it, right? The lived experience
Mhm.
piece is so important. And in this case, that bilingual piece is so important too. So let's talk about stigma now. Like, we had put together a little slide to show. Oh, thank you, Wesley, for posting the Compartiendo Esperanza information into our comments. That's great. So we put together a slide to address the need or actually the barriers for the need of mental health care in the Hispanic and Latinx communities. And this, we know stigma is a challenge across the country, but in the Latinx community, We know that only about 1/3 of adults who live with mental illness sought treatment last year. And that's compared to the average in the United States of all adults at 43%, which, mind you, is still quite low, right? So we're looking at less than half of all United States adults seeking treatment. But when we're looking specifically at the Hispanic and Latinx community, we're down to 1/3 of people who live with mental illness sought treatment last year. These are some of the barriers according to NAMI's national research. And what do you think about that, Vanessa? I want to turn to you and as the expert today.
Well, well, thank you for that. We try just to understand through our own experiences and stigma. Imagine during these times, some of the leaders has put that weight of saying in some states and in some communities that Latinos are one of a part of the cause of spreading the COVID-19, and you are stressed about that, and then on top you have that pressure of someone saying you this community, this specific community is part of the problem. So how you make that one someone who is stressed, who is struggling with any mental health condition to go and look for treatment when you have so many labels,
Yeah.
so you are so afraid, you there's so many things going on that it's important that we are out there. And when you were saying that if you have volunteers, if you don't speak Spanish but you know people who can speak Spanish, gather a group and we will go and we will, and we will talk
Yeah.
about everything that is happening, because especially during these times, we were doing a group, and we had the opportunity to talk about fear. And
Mhm.
when I opened to everybody, like, express how you feel, how are you feeling, everybody was like, I'm scared.
Mhm.
I'm scared, and I cannot show that to my family. Nobody can see that I'm afraid, that I'm struggling, that I don't know. I cough, and because I'm Hispanic, I have COVID, and I'm so many things. So we need to tell them, it's it. I don't know how to express the frustration sometimes that you
Mhm.
get, that um that this is not something that you should be embarrassed, or that you have to apologize to other people for, that you need to go and look and open a box, of freedom of yourself, like, this is for me, this is about me, this is about my family, and go look for the help that you need. And I think this is very important, that the work that we do together, that we need to provide the support, but we need to educate them. And it
Yes.
doesn't matter if you don't talk, if you don't speak Spanish, your effort is going to make a difference.
That's very true. Yeah.
Your effort is going to help someone that is struggling. That's going to make a difference, that you're trying to see, I understand you, you're not a threat, you are not the problem, this is not about you personally, it's something that anybody can have it. And
Mhm.
and you need to look support, and you need to look for help, because it's gonna make a difference in your community. One
Right.
person that looks for support is gonna bring more people.
Right. Absolutely. Well, you've had quite good turnout with interest as far as NAMI basics in Spanish, haven't you?
Yes.
So it certainly appears that there are people out there who are looking for this information. And the
Yes.
more we can offer that in language that people prefer, the better
Exactly.
we're going to be doing serving the community. You said a couple really important things, and I want to make sure that we can address those. And those of you who are tuning in now, please ask questions if you have any. But you talked about COVID. And I want to first say, before we even go into the COVID route, that we wanted to have this conversation with you outside of COVID too. But the fact that because we knew that that was already a challenge, right? That's always, it's been an existing challenge. But now that COVID has impacted all of us globally, and then in some communities more so,
Exactly.
you've shed light onto something that is further impacting, or could be further impacting, people from thinking they're safe to ask for help. So let's talk about that for a minute. And if you want to stop and you want to address our viewers who may prefer Spanish, please feel free to do that. But I want to make it very clear that people who are struggling with their mental health should look at this like you're struggling with a health problem. If you
Exactly.
have a health problem, you'll hopefully go see a doctor so that you can get some help for it, right?
Exactly.
Mental health problems, while our mental health is harder to see, it's invisible in that sense, it's real.
It is.
And then if we are fearful because of judgment
Yeah.
around the COVID-19 crisis, that's certainly an added barrier. But if any of the things that we've talked about, if Vanessa, you want to stop and share those in Spanish, we would be more than happy to do that. And later we can go back in and share that video excerpt just in Spanish. So feel free to do that if you'd like.
I just want to say, like I said, um, I'm going to say it in English, and so I'm going to say it later in Spanish.
Okay.
That you are not alone, and if you feel that you are stressed, that you cannot do this anymore, you need to look for support and help. You are not alone. You can contact NAMI, you can contact Delaware Family Voices, you can contact a lot of other support that has been established through the state, and go get assistance. Si tú estás sintiendo que tú tienes estás en un momento estresante en tu vida en el que tú necesitas que alguien te dé el apoyo que tú necesitas para buscar y desahogarte, hay a través de Delaware lugares que se han establecido que te van a brindar la ayuda para que tú recibas atención médica, porque una enfermedad o una condición mental no debe ser tratada diferente a ninguna otra condición. Hay a través de Delaware muchos grupos de apoyo que se han levantado. Contacta a Delaware Family Voices y también a NAMI para que recibas el apoyo que tú necesitas. I just say the same in Spanish.
Thank you very much. And we will work to clip that as its own excerpt so that we can share that. We have a Facebook page that is in Spanish, and we will take that excerpt and share that as well. Thank you so much for sharing that. So looking through the things that we had thought we'd talk about, the one thing we really haven't addressed is the programs that Delaware Family Voices offers that might connect to what we're discussing right now. Is there anything you'd like to share around that?
Well, right now, we are going to be, we have our parent to parent support, which is a program that when families who have had any kind of circumstances or recently diagnosed, they can participate in our training, and they get trained to become support parents to offer other families facing same diagnosis or circumstances, okay, support. And the support that a parent can provide is completely different from a professional, because we already know, we understand whatever you say, whatever is different, whatever you want to say to a professional, you can say it to another parent. So the support that they can bring is completely different. Also, during our MCO call, which the managed care organizations call, is a call that we have monthly, and it's every second Tuesday of the month. okay, where parents can call in and discuss any issues that they are having with their MCOs, Medicaid MCOs,
Mm-hmm.
the insurance companies, and if they are, I don't know, they have been denied services and things like
Mm-hmm.
that, they can come into the call and discuss everything. In September, we are going to have a special call where we are going to talk about, we are going to have more representative, Medicaid representative, and we are going to be talking about COVID, the impact of services and everything. If anybody would like to join, do it in Spanish, do it in English. We are going to be there opening the line so everybody call. Sometimes they have a lot of problem or issues getting mental health services.
Mm.
We're struggling to get mental health services covered, give us a call. Connect with us.
Thank you. Would you like to repeat that in Spanish too? Because that sounds like a really important aspect of what you're sharing.
Well, si estás teniendo algún tipo de problemas con obteniendo servicios de Medicaid a través, ya sean mentales o cualquier otro servicio para tus niños, la llamada, el segundo martes de septiembre, la llamada va a estar abierta para que te comuniques y podamos discutir cualquier tipo de servicio que estés tratando de obtener. No tienes que esperar a septiembre, puedes comunicarte con nosotros en cualquier momento Delaware Family Voices con mucho gusto te va a poder ayudar.
Thank you. Now we have a couple of comments from Cindy Garcia, and I'm going to kind of capture both of them. I think that will mess up Wesley. Wesley will probably share one of them, but Cindy has said two things, and I'll let Wesley post whichever one he'd like to. She's asking about services after hours in Spanish, and she's also asking how can people access the call that you were just referring to. So in general, do you have anything that you can help with as far as the call? And then I can address the other thing about the hours and native language.
Well, the call, I can provide the number. I need to look for it right now.
Oh, I
Very
think we
quick.
have it. Yeah, we have it.
The MCO call.
Oh, I don't know about that. We have your number 877-235-3588 for Delaware Family Voices, and then we have your website.
Yes, they
Can
can
they
also.
reach out to you?
Yes, 302-669 um 669-3033. That's my direct line. Okay.
Wow.
And
Okay. You
since
just put that out on video. You're going to get all sorts of calls now.
but I rather them calling that number
Oh, you're so
because
nice.
I'm working from home. So
Yeah.
yeah, it will be
Okay.
better and easier.
Awesome.
Yes.
Awesome. Okay. Well, that would be great. And as far as what Cindy was asking with services after hours and in their native language, I think she was following up on what we were talking about with the obstacles, perhaps. What I can tell you, Cindy, is that our two staff members that we're bringing on will be looking at making connections with providers who offer services in Spanish. And of course, after hours is a big part of that too. And we do have partners throughout the state who can help us with that work. But if you have anything, Cindy, or anyone else tuned into this call that you'd like to offer by way of helping us provide that information more broadly, please connect with us. You know, we're a small nonprofit trying to meet the needs throughout the state, and the more help we can get, the better we can do for everyone. It looks like Wesley, thank you for popping that into the chat for to reach Vanessa directly. So that's great. As far as our talk today, I think we covered a lot, Vanessa.
Yes, we did.
Yeah, and you know, here's the thing, and I'm going to put you on the spot right here on Facebook Live. Would you be willing to do something like this in Spanish next time?
Yes, yes. Just let me know and I will put it in my calendar.
Oh, that's wonderful. Okay, so it will probably be with one of our or both of our new staff members, Jackie and Esteban, and they're very excited to be doing this work. So I think it will be a great connection. And certainly, if you all can just loop into these conversations we've already started and further that conversation, we know that there's a lot of work to be done, and we are doing the best we can to keep up with it. But those of you tuned in, please reach out, namidelaware.org. You can reach out and let us know ways that we could be bringing this information to your community, services that you'd like to learn more about, and certainly with Vanessa's work at Delaware Family Voices and with the new NAMI Basics course virtually in Spanish coming soon. Please reach out to us if you are interested in that. We're really grateful to have Vanessa on our volunteer team, and certainly the connection with Delaware Family Voices proves to be continuing to be helpful to everyone involved, and certainly to the community. So any final thoughts? Any last words you'd like to say before we log off, Vanessa?
Well, to stay tuned so they can join the NAMI Basics. I hope that by the end of August we can start promoting the dates, the upcoming dates, and everything, so they can start registering.
Great. And we'll look for that, and we will definitely make that public on our website as well as on our Facebook page. Thank you, all of you, for tuning in. And until next time,
Thank
goodbye.
you. Bye.
Thanks, Vanessa. Bye.